A study published today in the New England Journal of Medicine caught our eye. It says that patients who are treated in intensive care units often leave with dementia, even when there was no evidence of it prior to their treatment. We asked Dr. Jon LaPook to look into this.
18 months ago, Lisa Uribe had gallbladder surgery. After the operation, she developed a severe infection and spent 3 weeks sedated in the intensive care unit. After waking up, she knew something was wrong.
I felt very confused, totally weak throughout my entire body. I thought this was something that would be normal for someone being in an ICU.
But after leaving the ICU, she never got better. Now 46, Uribe has short-term memory loss and trouble thinking. She's unable to work and sometimes gets lost when driving.
Being somewhere and not knowing why you're there or what your purpose was for being in this location, and it's a scary thing.
Very good.
Dr. Wes Ely of Vanderbilt University co-authored the study examining brain function in more than 800 patients who had spent time in the ICU.
What we found was a dramatic amount, 75% of patients leaving with cognitive impairment, and in fact, 1 in 3 leaving with cognitive impairment in the realm of Alzheimer's disease.
Those problems persisted for at least a year. There are several possible causes. Severe illness, which on its own can damage the brain. So can drugs used to sedate patients, as well as the disorienting environment of the ICU.
When they survive and they go through all of that ICU experience, then now they have to survive with essentially a new disease of the brain.
The study also found that younger patients had the same problems as older ones.
And that was the real new news here, was that people in their 30s and 40s, at the height of their earning capacity, etc., were leaving with this newly found brain problem.
Lisa Uribe tries to jog her memory with pictures.
Every day I wake up, keep thinking, this is a day I'm going to go back to my whole life.
This study ended in 2010. Since then, ICUs across the country have developed programs to try to prevent cognitive damage. And that includes lighter sedation, giving patients a better sense of day and night, and getting them up and around as soon as possible.
And Jon, last night you won an Emmy Award for your work on this program. We are so proud of you. Thank you.
Thanks.